Hello, everyone. Welcome to Israel Healthcare Highlights, where we share interesting information about Israeli healthcare with English-speaking audiences around the world. My name is Bruce Rosen, and our special guest today is Dr. Ruth Waitzberg. Ruth is one of Israel's leading experts on comparative health systems, and she plays a vital role in helping Israeli policymakers learn from health systems around the world and helps policymakers in other countries learn from Israeli healthcare. Our topic today is going to be the efficiency of the Israeli healthcare system. Let's start, Ruth, by please tell us a bit about yourself.
Yes. Hi, Bruce. I'm happy to be here with you and share what I know. So I was born in Brazil and I moved to Israel when I was 18, lived there for 25 years, where I studied my BA, my master's at the Hebrew University. My background is in sociology and public policy. And then I did my PhD in a joint PhD between Ben Gurion University of the Negev and the Technical University of Berlin. It was on assessing payment reform in Israel. And I came to Berlin 5 years ago to finish the PhD, was part of the program. And since then, I stayed here. I am based in Berlin now. So today, I am a researcher at the Technical University of Berlin. I am also a researcher at the European Observatory on Health Systems and Policies. And I am a researcher at the Brookdale Institute, and this is where most of my research is done. I have been working at Brookdale since 2007, and everything I know about health systems and research in health systems and health economics, I learned at Brookdale. So, and I continued learning about health systems and how to learn and understand health systems with my work at Observatory. And today I would like to show you how the research can be translated into policy recommendations. So actually what I do...
But before that,
yes,
please tell everybody here a bit more about the European Observatory and your role as Israel's representative to the observatory. How does the observatory work and how does Israel connect with it?
Yes, so the observatory is an organization funded by the European Commission, and they have researchers from different fields in health policy what they do is to gather evidence to help policymakers in different countries to improve health policy. And one of the main pillars of the observatory is comparing how different countries do policy. They create analytical frameworks to understand health systems in general, how they function and their goals, how to assess this performance. So they work a lot with indicators, and they connect with experts from each country to learn from these experts. So Brookdale was the organization representing Israel at the observatory, and within Brookdale, you and me, you started and then I continued representing Israel at the observatory. So we write books that describe the health system in Israel, its components, its functioning, its performance. We update on recent reforms and changes that can be interesting for other policymakers in other countries. Good examples of how Israel overcomes challenges and successful stories. And we meet once a year to exchange experiences and...
You mean all the country representatives from all the countries meet together and share experiences. Now, I know that maybe it was a couple of years ago, the top people in the Ministry of Health wanted to change the way the hours and the work hours of the medical residents. And if I remember correctly, you played a really important role by quickly contacting your friends in other countries. Can you talk to see how they do it? Could you talk about that a bit? And then we'll get to our main topic of efficiency. But I think your story is as important as the efficiency story here.
Yes. So just a moment. Noam. So the ministry needed information from other countries, things that are not available in publications. And the only way to get this information was to reaching out researchers from these other countries. And so I wrote to these colleagues, and just a moment, Bruce, maybe we have to make a cut because the dog is barking. Just a moment. Let me go, and I'll be back. 1 second.
Okay. Okay.
Okay. So, so the ministry needed information that only experts from their own countries could find. These were information that was not publicly available, not published. A lot of things that were in internal documents and policy documents in different languages, things that researchers from other countries don't have access to. So because we have this network of researchers and we know each other and we are good colleagues, I could reach out to them, and they helped me collect this data at their country. So they were vectors of that data collection on my behalf. So we also collaborate with them for their projects. So for example, now I am working on 2 projects giving information about Israel. One is on how Israel pays for rehabilitation care, and very interesting models of payments, for example, payment for coordination, and things that other countries can learn actually from Israel. So this is the added value of the work of the observatory.
That's terrific. Okay, so now let's get to our main topic. Ruth, is Israeli healthcare efficient or not?
So, of course, there is no one question, yes or no. And I want to share some slides for you to see how do we try to understand if the Israeli health system is efficient or not. Let me share. First, I want to say that this is part of the work that I do at the observatory in this comparative work. And without me as an expert on the Israeli health system, they would not be able to do this kind of work. So this shows the collaboration between the experts and what the observatory does. So can you see my slides?
Excellent.
Okay. So if any of you is interested in the data or more details of what I'm going to present today, you can see at this publication at the website of the observatory. So first, the observatory defines what is efficiency, because we cannot scrutinize efficiency without a theoretical framework. So it's not only policy, it's a bit of theory also that supports how we understand the performance of health systems. So there are 2 types of efficiency. One is technical efficiency. That means maximizing the output for a given set of inputs without undermining quality. And basically, it's saying doing the same at a lower cost. And doing the same could be increasing outputs without changing the costs and without undermining quality, or increasing the outputs without changing, or increasing quality without increasing the outputs and undermining quality. It's always a fraction, right? So you have the inputs and the outputs, and the product of these 2 elements is the efficiency. The second definition of efficiency is allocative efficiency, that indicates the extent to which limited funds are directed towards purchasing an appropriate mix of health services that maximize health improvements, which could be said also that we are doing the right thing for the right people at the right place. So if we treat those people that can have the biggest benefit from the health care. We are being more efficient, for example, than treating people that their benefits is lower. So how does that translate into the Israeli health system? So Israel has mandatory health insurance. It's universal coverage. Every resident is covered by the public system, even if these residents don't pay contributions. The statutory health insurance, it's called National Health Insurance in Israel, and it's funded by mandatory contributions for this insurance, and in Israel it's called the health tax, and it's complemented by government funds. So residents are entitled to be enrolled in any of the 4 competing national health plans. The health plans cannot reject applicants, and the health plans receive the money from the government that collected from both sources, from this health tax and from general taxes, and distributes that to the health plans. In general, the Israeli system spends very little money compared to other countries. And here in the left side of this chart, of this slide, we see that the public spending on health as a share of GDP in Israel, it's the purple line, it's lower compared to the EU average, to high-income countries average, and even to the average of the WHO European region, which includes also Eastern Europe. So one could say that Israel is very efficient because spends relatively low public funds in health. But to know if this is efficient or not, we have to look at the outputs, right? What are the consequences? Because this low spending could be interpreted like underfunding. So at the right side of this slide, I show you that life expectancy in Israel is very high, is the 4th highest in 2020, compared to a very long list of countries from Europe, WHO European region. So one could conclude that actually we are very efficient because we are doing the same at a lower cost. Actually, we are doing even better because we have a high life expectancy and a very low or lower public spending on health. However, life expectancy is not a very good indicator for the outcomes of the health system, because we know that there are a lot of elements outside the health system that influence life expectancy. For example, behavior, risky behavior or healthy behavior, genetics, the wealth of a country. We know that there is a very high correlation between the wealth of a country and life expectancy. So we try to not look at this indicator, although a lot of Israeli policymakers like to use this comparison. What we try to do is to find indicators of the outputs of the health system that are more related to the actions of the health system. And we prefer to look at preventable mortality or treatable mortality, because these are direct products of actions of the health system. And we see here that Israel has very low rates of preventable mortality. It's the 2nd one after Japan. It means that it performs super well in preventing mortality compared to other countries. So based on this, we can say that yes, Israel is super efficient because it has a very low spending on health compared to other countries. And nevertheless, it prevents mortality very efficient, very well, very effectively. If we look at treatable mortality, which is an indicator that touches much more directly on the actions of the health system itself, because it's treating the diseases that can be treated, Israel is on the average. So could be performing a bit better. It still performs much better than many countries. But if we look at treatable mortality, we are performing as the average countries in Europe or at the OECD. So we are doing the same at a lower cost. We are efficient in the technical efficiency definition, but we could be doing better. If we look at the allocative efficiency, I wanted to here focus on doing the right thing at the right place. And Israel does the right thing at the right place. For example, Israel spends a higher share on primary care than many other countries. So primary care in Israel is the purple slice in this pie chart is 41%, and it's a bigger share than other countries. Other countries spend more on hospital care. And we know that if we treat patients in the primary care, we can prevent hospitalizations. It's more efficient because it's less costly, and we can reach out more people and treat the diseases before they become severe and need hospitalizations. So in this sense, we have a very good allocative efficiency. We also have a high share of physicians that are that work as family physicians. And we also know that they are more efficient because they cost less to the system, and they can treat diseases on an early onset before specialists are needed or before we need hospitalizations. The problem is that the share of GPs in Israel is declining. And this should be something that the system could be watching very closely, because if this decline continues, we might lose a bit on this type of allocative efficiency. So looking at trends over time within the country is also important. It's not only important to compare Israel to other countries, it's also important to look how the trends change over time. So in this sense, we could still say that Israel has a very good allocative efficiency. There are other elements in the Israeli system that are very good for allocative efficiency. For example, health technology assessments. We are good at deciding what technologies and medicines will be covered by the public system through a very thorough process of health technology assessment and cost effectiveness analysis and so on. So this is another tool, and there are several tools. What I wanted to bring is the element of the right people, and we mentioned that we should be prioritizing people that can benefit more from the health services. And in Israel, although the spending on health is low compared to other countries, one interesting feature is that the voluntary health insurance part of this source of funding is much higher than other groups of countries, like high-income countries or the European Union countries. And also out-of-pocket spending, which is this blue share, is relatively high. So that means that these are private payments, and poor people might have difficulties because they have less money to pay for privately for care. So if we look at indicators like catastrophic spending, and the catastrophic spending is defined as households spending more than 40% of their free income after they spent already what they needed for the basic needs that includes food and electricity and housing and gas and water. If they spend more than 40% of this free income on health, they have catastrophic spending. And we see here that Israel has average levels of catastrophic spending, although the countries that have higher levels are East European countries, and we don't like to compare Israel to these countries because we want to compare ourselves to West Europe countries. We could be doing better because we see that the level of out-of-pocket in general of the health system in Israel is similar to other countries like Spain, where the catastrophic spending is much lower. And that means that in Israel, we have a high share of people that struggle to pay privately for healthcare. And these people could deserve a better treatment because they are the ones that most benefit from the health care.
Ruth, let me stop you for a minute. Do you know which groups of people are most at risk?
Yes, we know, and this is my next slide.
Oh, wow. Okay.
So catastrophic spending occurs mainly among the poor. There is another indicator of financial hardship, which is foregone care. So people that just cannot use health services because they cannot afford to pay them for these services. And this indicator shows that 11% of the population forgoes care on average, which is very high compared to European countries. In Europe, the average is between 2 and it's around 4%. And in Israel, it's 11%. It's very high. We see that people in the lowest quintile forgo almost twice as much as the average. So instead of 11%, 19% of people in the lowest quintile forgo care, and the ultra-Orthodox forgo care even in a higher rate. So we see here that these people are not getting the services that they should, and the country could be protecting them better from this financial hardship of privately paying for health services. So in this sense, the Israeli system could be performing better in allocative efficiency by protecting these low-income people from cost sharing and from services that are not covered well by the system currently.
It's interesting. I'm surprised. I see that the Arab population, the rate is just 10%, which is significant, but it's not higher than the average, and the Arabs tend to be poorer. And also the elderly is only 8%. That's
Yes.
sort of good news. How do you understand that?
So the policy of co-payments in Israel is a good one, and it does protect the older adults, mainly because they have discounts and exemptions in payments for medicines, for example, or there are ceilings for households on how much they can pay out of pocket for services that are covered by the health system. The problem are the services that are not covered. For example, oral health is very limited. It is covered for children and older adults. So we see that older adults are protected from out-of-pocket spending in oral health also. And this is why here they report lower shares of foregone care, because that would include foregone care in oral health, and they are better protected. The Arabs, they here, it's true that they are also poorer, but if I am not sure here if we control for income, but the Arabs, they have good access because probably they don't seek privately care. So they seek care in the public system, and they have access similar as the average.
Okay, that's good. Okay. What else you got for us, Ruth?
Now, I just wanted to conclude that efficiency is not only about lowering the costs, but also maintaining quality of care for those who most benefit from it. We see that the Israeli system performs well in technical efficiency, but there is a limit. And if public spending continues to be low, we might reach a point where the system is already underfunded and not only efficient. And there is also a cost that we might not see all the time, but it could be on the burnout of the health workforce and other disparities across population groups. And we also see that the system shows a mixed performance in allocative efficiency and usually does the right thing in the right place, but not always to the right people. And we could be protecting the poor more from catastrophic spending or foregone care. And it is important to highlight the strengths to be maintained, the strengths of the health system that should be maintained, but also to find the blind spots so policymakers can improve them. And this is what we do at Brookdale Institute. This is what we do at the observatory.
Ruth, that was terrific. Can I ask you to stop the sharing for a minute? So I also want to tell everybody here that Ruth is one of the part of the advisory team for Israel Healthcare Highlights. and she's great at both at telling us which topics she thinks we should cover, but also she's been constantly reminding us that we need to be balanced. It's good that there's things we're proud of in Israeli healthcare. We could highlight them, and that's great, but we should also not shy away from sharing also some of the problems. So I thank you for that, Ruth, as well. Ruth and I spoke briefly before this program. I asked her if she might be able to come back to us on another topic, and we have some ideas, and she's agreed. So I'd ask our viewers, after seeing the types of things Ruth does, what additional questions do you have that you'd like Ruth or experts like her to share with you? So that would be great. Ruth, thanks very much. Anything in conclusion?
I think that for policymakers, we have to highlight the good experiences of countries, but also how countries struggle to tackle some challenges. And this is the beauty of the work we do at Brookdale and at the Observatory, because showing a complex picture helps policymakers in all countries to improve the policymaking. And the same for Israel. I think that Israeli policymakers learn and benefit a lot from the work we do both at Brookdale and Observatory. And they value very much the work we do on both institutions.
Super. Thank you so much.